6, we're going to talk about the smoking. In general, smoking was a manly habit until 1940s, but after that, women, they started to smoke as well. In general, smoking just very much related to being sexy, sophisticated, just be intelligent and all that. There are like so many ways of smoking. For example, they're gonna be second-handed smoking in which you're gonna just smoke in the room and other people in the room, they're gonna get affected by that. Either they're gonna be your family member, your kids, or your coworker. Your book actually showing great examples of coworkers being impacted by someone else's smoking and get cancer because of that. So it is a deathly habit and it's going to increase the risk for everyone out there, either the smoker or people around them. So it's just bad habit. So here we're going to talk about synergistic effects of smoking. It actually boosts the damaging effects of other risk factors. For example, stress and smoking, they're going to interact in dangerous ways. So if you're stressed, you're going to smoke more. And stress itself, we talked about like different problems, which stress going to be a great factor for them. So stress itself, it's going to increase the rate of those disorders and disease. And smoking itself is just very dangerous as well. Just imagine if they would be together. So I mean, the person gonna be destroyed. So it seems like the substance in cigarette, like nicotine, it's gonna increase the heart rate reactivity to stress. In women also, it's gonna increase blood pressure as a response to stress. So I mean, smoking is bad. That's the whole idea here. But the point is, weight and smoking, they are very relevant. It seems like whenever you're just smoking more, you're gonna lose weight. And that's why so many women, they actually going for smoking because they feel like they can be fit because of smoking, which is true. Smoking literally gonna help you to just lose weight, but in a very negative way, because it's gonna increase the cancer, it's gonna increase depression, anxiety, and it is very bad for your skin. So avoid that. Um, so I do have a theory here again. In general, it seems like cigarette industry or like different industries like that, they're gonna target minorities and underaged people because it is just very easy to just influence them. So that's why they just try to sell like cigarette to just young people or get them addicted to cigarette from like age 12 because this way they're gonna just smoke more, they're gonna get addicted. So just selling cigarette is just guaranteed for at least like 5 years until they would be mature enough to quit smoking. You can check table 5.7 in which actually talking more about conspiracy theory, and just let me know if you have any questions about that. There are actually so many factors that are going to impact underage people, especially adolescents. First of all, peer pressure. If you do have like 5 people in your friends group who are smoking, you can see how those guys can just influence the whole group as well. Either you have to smoke or you have to just advise them not to smoke. So always they're going to be a challenge with them. Another one gonna be interacting with the smokers. If you do have so many friends who are smoking, again, you're gonna be just kind of attracted to smoking and you're gonna smoke and like eventually. Attitudes and influence from your family. It's just very important. If your dad, if your mom, they're smoking, you are just kind of familiar with that and probably you're gonna actually lean to that. Socioeconomic status, we already said that people from lower socioeconomic status, they might be more like, I mean, they might have more tendency to just be a smoker because the industry in general, they're gonna target them. And the last one gonna be lack of discipline and monitoring in the schools. So if the school would not be a good one, if it would be from a low socioeconomic neighborhood, of course they wouldn't care about students' mental health or smoking behavior. So they're not gonna be any discipline on that end. However, in good schools and like somewhere that actually authorities they care about the students, they're gonna be a strict discipline against smoking. They're gonna stop the students from smoking. And other factors that can be associated with smoking gonna be depression. We all know that. Stress. As you are more stressed, you're gonna smoke more. Low self-esteem. Yes, that's very correct. When you do have low self-esteem, you feel like you are just dependent to a substance, or you don't feel like controlling yourself. So that's why you're smoking more. Social isolation. If you feel like isolated, if you feel like you cannot actually communicate your ideas, your thoughts, or even just interact with people, you're gonna smoke more and more. So if you do have a smoker friend around yourself, just try to just, interact with them, just try to just talk to them, so this way they're gonna actually break down that isolation and they can just be more engaged in different social occasions, so the chance of smoking is gonna be less. Another point about social isolation is whenever you're isolated, you can do whatever, you can just do drugs because no one around you gonna actually tell you not to do so, or no one actually cares because like there is no one around you. But when you are in a friend group, you have to follow their rules, and majority of friends, they don't, I mean, hopefully they don't do drugs, or they actually don't like a smoker friend, so that's why you want to stop smoking. So the question here is why smoking is just so hard to change? Because it is very enjoyable. Let's be honest. Like the whole idea of having nicotine in your body, it's just very enjoyable. I mean, you feel like so good. It's a good pattern, honestly. Like, I mean, not now, but like back then, it was like tied to just being classy, being sexy, and all that. So people, they were just trying to just idolizing different celebrities who smoking a lot to just be one of them, or just imitate them at some point. If you would just quit smoking, it's going to bring you some unpleasant withdrawal symptoms that is very hard to stop. Like everything gonna be disaster. I know like drugs, they are just very hard, but smoking is just very hard as well because like even your hands gonna be used to smoking all the time. So it's just very hard to just drop that behavior. Smoking in general, it's gonna elevate your mood, if that makes sense. So if you would just stop that, you're gonna have a hard time and you're gonna be grumpy all day, you're gonna be depressed, stressed, and all that. Like I said, it's gonna help you to be fit, like it's gonna make you skinny. So I mean, again, majority of women, they love smoking, especially like I don't know if you ever visited Paris, but whenever you are going to France, you can see so many French people, they're smoking all the way and they are very fit. Maybe that's the key because it literally keeps weight down. um so how can we actually help smokers to reduce smoking in a day or in general? First of all, gonna be changing attitudes toward smoking. Like previously, the whole idea around smoking, it was like it's a sexy behavior, just so good. But nowadays, mass media, especially TV, they are actually showing a smoker as a bad, negative person, or as someone who doesn't smelling so bad, or someone who is annoying. So it's a good way actually. The influence is just very positive from TV and like different streaming channels. Um, so vaping actually nowadays it's a better behavior. I mean, vaping has its own problem, but at least it doesn't like smell so bad. It could be a good replacement for that. They're gonna be nicotine replacement therapy. It is helpful too. There are like some interventions for stop smoking as well, but inside that intervention, you should consider relapse problem as well. Like whenever you are doing intervention, you have to consider the possibility of doing relapse, like from the beginning. Couple-based therapy or social support and a stress management program, they are very important as well. Interventions with adolescents is just very important because we're gonna teach them autonomy and self-control. So this way, we're gonna boost their self-esteem. So they actually feel powerful and they can just stop the smoking behavior. In general, smoking is just related to just feeling powerless, like you cannot control anything. So the only point that you can control in your life is just smoking. So that's why you're gonna do that more and more. So if you do have a person that, or a patient, like just imagine like I heard that Dua Lipa, she's smoking a lot. So if you have like Dua Lipa in front of you asking you for advice to quit the smoking, the first point you should just ask them is just pick a day on their calendar for starting point, as like a starting point for quitting smoking. Another one gonna be just asking for social support. Another one, just teach them some interventions that can help them to increase their autonomy or self-control. You can just help them to just go for some replacement, which can be even more helpful, and just seek social support for them. I mean, she's very famous. Probably she does have so many friends, and she's very popular and all that, but like a stress management can be applicable as well. Again, whenever you are doing intervention, whatever it is, you have to consider relapse. It seems like 50% of abstinence, I'm not talking about relapse, abstinence, gonna happen during the first 2 years. And again, that is normal if it is happening. Don't be hard on yourself. But consider that if you have any intervention, CBT, whatever it is, consider relapse possibility as well. So there are like some workplace interventions that is very helpful, especially in big companies and fast-paced companies. For example, in Facebook, they do have like different intervention groups for their employees, because the stress level in Facebook is just very high. They have to work like in a very fast-paced. So that's why they consider all the mental problems in their employees. Another one gonna be self-help aids. For example, quit lines, they are just very popular in the United States. Internet interventions, this is important as well. And warning labels. For example, whenever you are just purchasing a packet of cigarette, you can just see a sign on top of that, that literally saying that, hey, cigarette actually bring you cancer. It's not good. And if you actually seeing that warning, it might stop you at some point buying cigarette. It is a good approach, but the problem is, I mean, a smoker gonna just purchase that cigarette anyway, even though they are just seeing the warning labels. And I guess they are just kind of used to that, like habituation gonna happen in them. So after a point, they wouldn't care about warning labels, but just having them is just necessary. So the main prevention program gonna be potential smokers early in life. For example, like we said, we know that minorities, they do have a tendency for smoking, and we know that underage people who are just younger, they're gonna smoke more, and they do have like motivation for doing so, because they are going through puberty, and especially if they are coming from a bad background, they definitely need to just reduce their stress level. So smoking gonna be very enjoyable for them. So we have to target them. We have to just educate them, especially at a school, about negative impact of smoking. We have to show them different research that actually bringing the point about how smoking can just impact skin, can bring you cancer. And on the other hand, we have to show, I mean, while we are showing the negative impact of smoking, we have to show the positive image of a non-smoker, how successful they are, how they can just manage their life, how they can just control their life. Another one gonna be peer groups. So if we can see a group of people who are smoking, we can just adjust a focus group for them, or just help them to just quit smoking using quit lines, and or make a specific discipline for them, especially at the school. That is all for this chapter. I hope you enjoyed listening to me. And I actually mentioned some points that are necessary for your quiz. So check the lecture again before taking the quiz, and also check your textbook, and let me know if you have any questions. Thank you.